On this show, we'll dive into the complex realities of harm reduction, substance use disorder, homelessness, and related topics.
We want to emphasize that while we have extensive frontline experience in these areas, we are not accredited professionals. Therefore, despite thorough research, factual inaccuracies may occur from time to time.
We are passionate advocates who prioritize lived experiences and compassion in all discussions. Our conversations may contain explicit language and address topics that can be upsetting to some listeners.
We encourage everyone to engage with an open mind and understand that our goal is to foster understanding, empathy, and support for those impacted by these issues. We just filmed like 10 minutes of us talking. I had this like feeling that this should be in view. So like we can see that it's recording because we just filmed a whole bunch of minutes of us talking and it wasn't recording. So now I just kind of want to like see it.
These things are going to happen along the way, and the fun we have. I'm not really good at technology, so.
Well, me neither apparently.
You're still leagues ahead of me, dear.
Oh my god. Hi, welcome. I feel like we've just done this, so like this feels like very counterintuitive. But
We need the little
hi
Disney
everyone,
thing.
welcome to our podcast, A Dose of Reality.
Thank you for coming. This is our first episode.
Yeah, we're kind of nervous. We might ramble a little bit starting off. We're kind of still trying to figure out the groove and get into things, but this is our podcast called A Dose of Reality.
The dose?
A dose.
A dose.
On the mug it says
Son of
a.
a gun. We fight about this sometimes. I can never
It's fine.
remember.
It's at least you're not calling it the daily dose.
Well, fair enough.
For a
but
while, that's what you were calling it.
that's a little tidbit of things to come, so
Yes.
we won't make for a spoiler
Teaser.
alert. That's right.
Easier. So, what is a daily dose of reality, Tanya? What is it?
In my opinion, Cassandra, I believe the daily dose is just a little tidbit of information, a little insight into people in our community's lives. We're going to be dealing about homelessness and substance use, housing, how, our community is without housing for our folks, which is a basic need. It's just an opportunity, in my opinion, to get a little bit more truth out there so that people aren't hanging on to falsehoods and making assumptions that are harmful.
Yeah, it's essentially a podcast about harm reduction, substance use disorder, homelessness, and any and all topics that are related to that.
Yeah, we got a pretty good lineups. Not really set up already, but our ideas are pretty bomb.
I mean, it's a big topic. It's a lot of things to cover. It's not something that can be done in an episode. It's going to take multiple episodes to even explain like a topic. So it's the topics will be heavy sometimes.
There will be explicit language.
There will be,
Sometimes.
but the goal is to make it fun and approachable and be serious when it needs to be serious, but also just have fun with it as we deliver this information.
Absolutely.
We are not quote unquote professionals by any means. I mean, I guess we are in the sense, we are frontline workers.
Yeah.
We do, between us, have many years on the front line.
Yeah, with many things that we've experienced, even from the beginning and learning and to being where we are now. And to me, I feel it's a fill of compassion. This is my dream job in all truth and honesty. My favorite job to date is being an employee of Ensemble. I get to help people daily. It's incredible.
Yeah.
So we may not be professionals, but we've definitely seen a lot of things.
Yeah, and the reasons, I guess if you were going to say the reasons for the podcast, we want to help break down barriers and kind of eliminate stigma that comes with being a vulnerable population, specifically when you are homeless and or use substances, because not all individuals who are homeless engage in substance use, and not all people who engage in substance use are homeless.
And that's a big one just in itself.
Yeah.
We'll get on more with that topic
Jumping
another
ahead
day.
of ourselves. It's just trying to introduce these topics. It can feel like a lot because there's so many topics. You're just like, what do we talk about now? But we've been talking about this for months.
Yeah.
And you said it before, but we weren't recording. You've done a podcast before.
It was just a small snippet on one of my friends' podcasts. She did fashion and makeup and all those lovely girl things, and I was still at Shoppers, so I did makeup tutorials. Not the sex hotline, but that's a topic for another day. But yeah, it was fun. It was fun.
Yeah, and they're hot commodities right now. If people listen to this, who
Yeah.
knows? But we've been talking about it a while, and when you're trying to think of ideas on how to, make these topics approachable to the general public and how to get people to see, the lives of someone who is homeless and has substance use disorder, or someone who is not homeless and has substance use disorder, but also the lives of, like, we talk about, we want to bring attention to frontline workers, and this is in no way diminishing the work they do, but we all know about healthcare workers and social workers and the police force and what have you. Like, we know of those, but there is a subgroup of frontline workers that, they don't get the recognition they deserve, and that is the frontline workers who work in what we call in community.
Yeah.
And when we say in community, because we will say it probably multiple times, we mean the community of homelessness.
Yes.
The community of people who are homeless and use substances.
Yeah.
So you have Tanya and myself, and we will introduce ourselves a bit more in a second. But we do work at Ensemble, which is the local needle distribution service and overdose prevention site in our town. And, so we would be considered frontline workers in community, along with the shelter workers and the
Case managers and oh, why can't I think of titles?
I
right
know,
off
I
the
was just
huff?
like blanked. I'm so glad you jumped in with case managers, because I was like,
That's not
But
the only one.
those frontline workers, bring attention to those and the work we do,
And the good work
and
they
the good
do.
work we do, right?
Yeah.
So
There's a lot of good things going on in community.
yeah, there is. So
Yeah.
bring attention to it's substance use disorder and homelessness are very multifaceted. So bringing attention to all of those facets and trying to
We'll make it exciting.
make it fun and exciting, as boring as it sounds. So, the one thing we will note, and Tanya agrees with me on this because I've mentioned to her before, when I go out in community and I do presentations and trainings, I always say, I'm not here, and Tanya and I are not here to change people's minds. That's not the goal. We're not going to sit here and be like, you need to think like this because this is the right way to think, and what you've raised to do is the wrong way to think. That's not our goal.
No.
We just the goal would be, let's take a topic that is kind of very niche and taboo, and people don't talk about as much, or people talk about it in a certain light, and just be like, hey, have you ever thought that maybe you could start thinking about it like this?
Yeah.
And put a different perspective on it.
Reducing the stigma.
Yeah.
People don't even realize they're stigmatizing people,
No.
but some of the comments, holy snappers. It's and it can be so off the cuff too. People just trying to, I don't know. I mean, I don't like labels. I'll be the first one to say it. I don't. I mean, it does come up in general conversation when you're talking. Like, it'd be nothing to talk to somebody and say, you're working down at Ensemble, so on and so forth. Oh, you're working with the junkies. I don't like labels. I'm working with human beings that are struggling. I'm not working with junkies. Like, and no disrespect to anybody that uses that term. Maybe they just don't know of a different term to use because that's all they've ever heard used before.
Yeah, and I think that's a good segue into some disclaimers. When we talk about people who use these language, or we say when people say this, or when people act like this, we're not necessarily targeting people. It's just kind of, the social norm to think and act a certain way. So usually when we say, like, we think like this, or when people think like this, we mean society as a whole. It's not like a specific group of individuals.
Oh, hard no.
And
no,
also,
no,
I
no.
think we should put a disclaimer just to cover our butts. Tanya and I are employees of Ensemble. And that being said, some of the things we will say, not all the things we say will reflect the views of Ensemble. I think
Fair
is
enough.
a good thing, good
Yeah.
way to cover our little tushies. So that's a good segue. Who are we? Hi, we haven't even mentioned our names because we did that before when we weren't recording, and I completely forgot. Hi, I'm Cassandra.
And I'm Tanya.
Yeah, we're both employees of Ensemble, so I am the harm reduction educator here, which, like, yeah, I have, like, beef with my title name.
What
Beef, not like beef. Like, I just, harm reduction educator makes me sound like I'm an expert. I feel like
You're
it
an
makes me,
expert?
well,
Compared to some people,
compared
that
to
don't have
some,
the
I
same
guess,
level of knowledge.
Yeah. So, yeah, that's kind of my role. I've been with Ensemble now for 3 or 4 years now.
Oh, nice.
Not that long, but long. I climbed my way up that corporate ladder.
And now you're senior
Now
staff.
I'm senior staff.
Yet I'm the senior, whatever.
So, no, I started here at Ensemble. I'll tell the quick, brief story out of the Cliff Notes version of how I started, I guess. So I started, honestly, I applied because I just wanted a more stable job, like more Monday to Friday job. And not for the money. No one works in this field for the money.
No.
But a mutual, I had a friend on Facebook at the time who shared the link for it's called the youth program, like the Canada Summer Jobs Employment Program that Ensemble had, and it was for like 8 weeks. So we like lived in residence together on campus, and so I had her on Facebook, and she did volunteer work at the Y. Mm-hmm. So she re-shared the link they posted that they were hiring, and I was like, oh, like I could probably pull it up on Facebook and show you what it said. It was like administration work, planning fundraisers, like helping like make harm reduction kits, and I was like, I don't know what that is, but like cool, I guess. I can use a computer, I can plan things. I'm like a planner and an organizer. So I applied, and I got the job because in my interview on my resume, it said I went to high school in Dildo, Newfoundland. And
she's a dildoian.
Yeah, honestly, in my interview, it was with Bridget, who does our bookkeeping administrative work, and an employee we had in the past, Sarah. They both interviewed me. And Bridget didn't even say hello, I don't think. She just kind of looked, and she goes, so you're from Dildo?
Icebreaker.
And I got hired. I don't think that's why I got hired, but I like to tell people that's why I got hired, is because I'm from Dildo. So I didn't know what this place was. Yeah. Our website didn't really tell me. Mm-hmm. I thought we were something to do with LGBTQ youth. Right. And then I came my first shift, and my supervisor at the time, Ashley, she she said, here's a meth pipe, give it to that person. And I was like, who? Excuse me?
First exposure.
Excuse me. Well, because I grew up, like, I didn't grow up being raised, like, you know, hate this population of people. But, like, I grew up with that same societal mindset that, you know, if you're walking down the street and someone who is perceived as homeless or, you know, a junkie, right, to like cross the street and walk on the other side of the road. Yeah. So like that's how I was raised. So like to all of a sudden be thrust into a job where, you know, I didn't go to school for this. I didn't I didn't get a college degree in what's it now called, like human service counseling or what have you. Like I didn't do that. I went to school and got an English degree. So like to be thrown into this world, it was kind of like a shock. Like it was a big jarring, like kind of, whoa, where like it took me a while to figure out if I liked it and if I wanted to stay here. And then my first day of my second week, there was a stabbing in the parking lot.
Just thinking about that story.
He's fine and well. Very well, actually. He's
Indeed.
doing very well now, but he's fine and well. He lived that day, but that was kind of my first exposure to like the realities of this world, I guess.
And it is the realities. We'll unpack it more later, but
my trauma response has like shifted 180.
Oh, I can
like
imagine.
I think about myself that day and like how I responded in that situation and like completely froze and like was shaking, didn't know how to like cope with that, to be thrust into like a crisis situation like that. And now I hear sirens, and I'm like, is that here? It's not really here. We hear sirens because we have an overdose prevention site, but like, not because people are getting stabbed in the parking lot every day, but like...
And we're in the heart of Moncton downtown, so we hear sirens constantly.
So...
Do you hear sirens constantly at your home?
No, because I live in Dieppe and nothing bad happens in Dieppe.
Well, anyway, I don't live in Dieppe, and I'm not downtown Moncton
Dieppe
anymore.
is like a paradise. Nothing bad happens in Dieppe.
Oh, your rainbow-colored glasses, God love you. But at home, we hear them all the time.
Yeah.
Constantly. And I mean, we're a 10-minute drive away, but there's so many sirens here all the time.
It's
but
just different to gauge your like trauma response when you work in like a traumatic, like not traumatic situations all the time, but like in like a high crisis
yeah.
situation all the time. So that's kind of like one thing led to another. I worked in the needle distribution for years, climbed that ladder. Now I do education and
your
senior staff, and I lead a team of needle distributioners.
Yes, you do.
My little team. So that's my very long short story. Tanya, what's your long short story?
Well,
What's your role here at Ensemble?
Oh, yeah.
How long have you been in community? Because you've been in community longer than you've been at Ensemble.
I think I've been in community since 2019 when I first got hired at John Howard Society, and I'm here now at Ensemble. I'm a wellness navigator, and I just sum it up with if anybody has a question, concern, a problem, come to me and I'll see how I can find out the answer. If I don't already know it, we'll work towards it. Mm-hmm. We navigate basically the social systems, which don't have any barriers at all. So that's
navigate
fun.
Social complex system.
Yeah, I don't like saying it that way. I'm like, bah. I just answer questions. But it's an incredible job. It's my favorite job to date. I mean, just a small recap. I've been a condom sales rep. I've worked at Shoppers as a cosmetics manager. I used to be a florist. I've done a slew of things, but this is by far the best job I've ever had.
Yeah.
I'm very passionate about getting some understanding out to folks. I mean, it doesn't even have to be our community. If somebody's bored enough to listen to our podcast from a different city, please do. I'm sure it'll be relatable in your area as well, but that's my passion.
Yeah. We are also both certified medically. What is it?
Medical first responders.
We are trained and certified medical first responders.
Oh, it was such an amazing course.
Yeah.
The science was bomb.
Yeah.
But and that's amazing that Ensemble sent us for that because we've worked in the OPS a lot, and it's been amazing.
Yeah, and well, you just made a good point. Oh, not a point, sorry, but you just reminded me of something. Typically, when we say OPS, we mean overdose prevention site.
Yes.
It's just the abbreviation.
Yeah, I use the acronym.
The acronym, yeah. And then when we say NDS, we usually mean needle distribution service. So just like a little tidbit. But yeah, we both done shifts. You know, I started here working at the needle distribution center site.
Yeah,
center.
You know,
but service, I guess, is what it is.
Yeah.
Needle distribution service. And, you know, Tanya's done many years of street outreach.
Yeah, that's right too.
We have both done shifts in the overdose prevention site. We have both responded to overdoses many a times.
Yeah.
Yeah, so that's kind of like why we feel like we are credited enough to talk about these topics, because we do see these folks more than we even see like our own families.
Oh,
right?
for sure. So absolutely.
We hang out with them a lot more, and they're a lot more entertaining than our own families.
But we have so many amazing folks that come to use our services. We're very, very blessed.
We
to
are,
have.
and I think it lends into the next kind of like overview. This episode is going to be a lot of like kind of introduction. What are we talking about? What's an overview of this? What's an overview of that? And the next thing I think is, you know, we, as employees of Ensemble, we've kind of adapted in our personal and work lives, I think, the concept and the practice and the approach of harm reduction. And the whole point of everything we do when we, you know, whether it's street outreach or it's working the needle distribution or the overdose prevention site, it's to prevent the spread of sexually transmitted and bloodborne infections in the community.
Yeah.
And this time when I say community, I mean
Moncton community.
The world, the worldly community, not just like a pocket of people, but like.
Which we'll do an episode on, I would think, because it doesn't sound that exciting when you say, oh, we're passing out clean supplies because of bloodborne infections or transmittable diseases. But when you unpack why
Yeah, there's a big reason
It's
behind it.
huge.
Right?
It's not
So-
just enabling people to use more drugs. And by the way, we don't sell drugs here in case anybody has heard that before. No, we don't sell drugs. We give out clean supplies. So yes, we'll unpack that on another episode because it's so
No, I think that's important to
crazy.
unpack now. Ensemble does not distribute any form of substances.
that's
people.
important. Absolutely. But anyhow, moving forward, we don't. So we're going to have fun explaining some different ideas, some different topics. People are going to give you a little tidbit into their lives. We're going to be doing different interviews too, and just trying to have a little fun getting the word out.
So let's just do some housekeeping little facts right now.
Yeah.
Just to get kind of, she's putting on her glasses. The people listening, she just took up her glasses and put them on. So we say harm reduction. That sounds weird. What does that mean? Harm reduction. Never heard of that in my life.
I mean, it's a
What
great
does harm?
title,
Yeah.
but
What does harm reduction mean to you, Tanya? When you hear harm reduction, what does it mean?
it was best said by Paul. Human decency.
Very famous guy named Paul.
If you see somebody hungry, get them a sandwich. Somebody's cold, grab them a sweater. You know, it's not just all about giving clean supplies for use. It's taking care of people, being a human being. If you see somebody in need, help. It could be as simple by a small smile. A smile could even be seen as harm reduction in some ways because you just be good to people.
Yeah.
It's human decency. Paul said it perfect.
It is. And I guess if you want to get, like, by the book, the definition of it would be, you know, harm reduction focuses on making people's lives healthier and better regardless of their choice to use or not use substances. So sometimes people get confused with enabling, get harm reduction and enabling confused. And I, as someone who, again, was thrown into this world and kind of, like, stumbled upon it by accident, I 100% get that.
Oh, for sure.
Because for the first few weeks I worked here, I couldn't wrap my head around how is handing out these supplies not enabling any form of substance use. Like, how is that any different? But substance use exists. It has always existed, and it is a big part of society and, you know, the world, really.
It's
and
here.
we, you know, there are many different types of substances we will get into in the future, but just because someone uses substances does not mean that their lives don't have value anymore. They are still very much a person, a human being, and they deserve to be treated as such. What harm reduction is doing when you practice harm reduction and when you hand out these needles and these pipes and all these things, what it is doing is it is attempting to minimize any risks that come
Absolutely.
with substance use. So people are going to use, like, no matter if Ensemble was here, no matter if needle distributions or needle exchanges or overdose prevention sites, no matter if these places exist, people are going to use.
Mm-hmm.
That's just a fact. We want to do everything we can to make that process a lot healthier
Absolutely.
for them, so that when they eventually do reach a point where they are mentally ready and they have that confidence in themselves to, you know, join recovery programs or go to detox or go to rehab or what have you, they are alive to do that,
Yes.
right?
And that's it.
So
They're alive to do so.
yeah,
Keep people safe and alive.
right. And, like, people say all the time, oh, there's needles in the parks and there's needles all over the sidewalks and there's needles here and there's needles there, and think about the children, think about the pets. And people don't realize how much harm reduction actually helps protect the community also,
Oh, yeah.
because in reality you don't see that many needles in parks, you don't see that many
No.
needles on sidewalks. And if we didn't have harm reduction programs, the spread of sexually transmitted diseases would spread
Yeah.
a
and
lot
Hep
quicker.
C
And Hep C and,
yeah.
you know, HIV and those things, it would spread
Yeah.
a lot quicker in the community. So, yeah.
we're not going to eradicate drugs anytime soon.
No.
So let's face it, this stuff is going to be
No.
around for a while. So let's
No.
keep people as safe as possible on their journey.
And harm reduction doesn't just apply to drug use.
No, goodness, it's in every avenue. If you're without, I mean, just give somebody a blanket if they're cold. That's harm reduction. You're just loving people.
Well, because then if you give someone a blanket when they're cold, then you're reducing their risk of contracting hypothermia, right?
Ah, yeah.
So like,
Lots of risks out
wearing
there.
your seatbelt when you're driving,
Absolutely.
that's a form of harm reduction.
Brushing your teeth if you want to get fancy.
But wearing your
Seriously.
even like speed bumps on the road
Yeah.
are harm reduction.
For sure.
What else? Like COVID masks, like when we all wore those masks during
Yeah.
COVID, when birth control,
Yeah. Reducing harms.
liquor stores.
There's a slew.
Like there are, and when you criminalize something, you don't make it go away, right? So, abortion has shown us that in the States. The alcohol prohibition has shown us that. Cannabis has shown us that.
Yeah.
You know, when you criminalize something, you don't make it go away. So,
That's another topic we need to.
that's a whole other topic. But I think the main point right now is to understand that when we talk about harm reduction, we're treating people like they're people. We're showing them respect. We're giving them compassion. We are, we're not pro-drug. We're not anti-drug. We're not going to sit here and be like, drugs are good, boys and girls. We're going to go try drugs. We both, I think, can like attest to the fact that drugs are terrible.
Well, yeah.
They've taken a lot of people from us both.
Oh, they really have. We've lost so many amazing people.
Just in our professional lives.
Yeah.
Like that's just...
Which kind of leaks into our personal, because some people just wrap around our hearts and we just love them so much, and it's an absolute... I don't even know how to describe it. I mean, every time we hear a death, it takes about, I don't know how long, I mean, but on a whole, it affects us at work. Yeah. These are people we spend time with every day. Like, it's gut-wrenching. It is. Overdoses are too high.
And there is a lot of evidence to show that harm reduction works. So before y'all come at us and be like, you leftists, there is a ton of evidence that shows how it works. And, you know, we're not going to touch on that. We're not going to, not right now anyway, we're not going to get into all the statistics and all the numbers and the what have yous that have been conducted to prove that it works. But it does work, and it saves a lot of money.
And that's what people don't realize either.
Oh.
There's statistics about how much somebody who isn't housed, how much money is spent through healthcare compared to somebody who's housed and somebody who spends money on healthcare. Like, it's astronomical.
Well, do you know, like, one syringe is like a couple cents, I mean, like less than $1 for a syringe, I would say. And if you contract endocarditis, the disease of the lining of the heart, if you contract that from sharing a needle, that's tens of thousands of dollars on the healthcare system.
Yeah, lengthy stay inside,
right?
Procedures, so on and so forth. People don't understand it. And again, it's kind of the point of our podcast. There's little things that connect, and then we're trying to like unpack it so there's understanding, because that's the problem. Not everybody has those access to that knowledge or even an interest. But once you realize what's really going on, you can get on board a little bit better. I mean, our healthcare system, for starters, is in the toilet. So, yes, and I am still grateful I didn't have to walk 3 days to get to the next village that had a hospital. But, I mean, our healthcare is in trouble. And there's just different pockets that we can discuss as time presses past.
Yeah,
so.
all this is just kind of an overview of what do you expect from the podcast, you know?
Give us a chance. We have lots to tell you. And we'll have a little fun along the side, too.
And I think we do need to touch on, like, what is an addiction?
Yeah.
Because that's
not everybody has the same understanding of what an addiction is either.
No.
Some people think it's a choice. Some people think, oh, well, they were in with the wrong crowd. there's so many, some say it's hereditary, some say it's got nothing to do with an actual condition. It's just a bunch of jargon thrown on people to make things look better. There's scientific information, people, that explain that it affects the brain. A complex, multifactorial health disorder characterized by chronic and relapsing nature. This is preventable and treatable.
What Tanya just read came from the.
I was supposed to sound good.
You sound lovely.
Oh, thank you.
But you could have said that this is from. Tanya just read a quote.
I was trying to sound intelligent.
You are intelligent.
Oh, bless your heart.
Stop it.
Okay, fine.
The blonde is dyed.
Yeah, this is fake blonde, and not that you can see it, but yeah.
But they said, I think it was the 2016 United Nations General Assembly special session on drugs. So the United Nations in 2016 defined.
I couldn't figure it out either.
Drug addiction, as Tanya just said, a multifaceted, chronic health brain disorder.
Did you know I was at the United Nations?
I didn't.
I have actually been in that building. I know. It was a school trip. It was incredible in the building.
Are you
It was like, yeah. It was in grade 9. Went to New York City, did a bunch of exploring there.
So you're a sex hotline worker. You've done podcasting before. You've been to United Nations.
I mean, can you guess what's next?
Woman, she's full of surprises. My God.
I just think
all I got is, hi, my name's Cassandra. I'm from Dildo.
But that is so good, though.
Do you know what a dildo is?
Why, yes, I do.
No, not that kind of.
Okay. I'm like, where the hell's this going?
I Googled this once. So I was like, how could they name a town?
I wondered myself.
After a dildo. Right? It's a part of a boat.
Come again.
Honest to God, I think it's like the part of the boat that they like wrap the rope around. Like that little kind of like...
Grommety kind of...
Yeah, I think. That's a
Isn't
dildo.
that something?
Yeah, so that is why the very small fishing town, Dildo, Newfoundland, is called Dildo.
Do you know what? I think our folks just got their daily dose. That's your information. Look at that, listeners. We now know there's a part on a boat called a dildo.
That may be totally wrong. I don't know. But like, that's
again.
Fun fact also, number 2, there is no sex shop in Dildo.
What?
I know. That's a missed marketing opportunity.
That's almost like an oxymoron.
I know.
Wow.
Like
2 daily doses.
How do you not put a sex shop in Dildo? There's also a South Dildo.
What?
There's Dildo and then there's South Dildo. And in Dildo, there's a spread eagle.
And what's that one? Come by the Bay?
Come by Chance.
Come by Chance.
That's another one. Conception Bay is another one. There's also Conception Bay North and South.
You can't tell me they didn't have sex on their mind.
That's a lot of Newfoundland places. Not a lot, but more so at the West Coast. They're like French names.
Oh, really?
Like Port de Basque.
That's the only one I could think of.
Port de Grave. It's actually like Port de, like D-E.
Yeah.
Grave. It's
I
French.
didn't know that
until I took my Acadian boyfriend home. And he pointed it out. I was like, you know what? Now that you say that, that makes sense.
Well, come by chance.
So.
I'm sorry, I couldn't resist.
We told this off topic.
I'm not sure where we were, but I think I took a very serious sentence and kind of ruined it for you.
No, you know what? We were talking about the United Nations and how they said that drug addiction was a very complex, multifaceted health disorder categorized by chronic and relapsing nature.
Which by no means in there did it say it's a choice.
No. I always tell people, the more research I've done on it, I've looked into if it's a choice, if it's a disease. I've seen those debates before online. Yeah. It's way more complicated than being like if it's a choice or is it a disease. Because if it's a choice, follow me for a second. Stay with me for a second.
I'm ready.
Follow me? You got me.
I'm picking up what you're putting down.
If it's a choice, like if someone were to wake up in the morning and say, you know what I need to do today to make it through this day, or I'm not making it till tomorrow. If they need to make that choice, there are multiple steps or like multiple little traumatic steps or
Yeah.
a big traumatic event that has led them to make that choice.
Background story
And a
kind of
background,
thing.
yeah, that led to them making that choice,
Yeah.
right?
Yeah.
And we will talk later. So this whole episode is just being like, we'll touch on this later. We'll talk about this later. But we will get into like, you know, the links of mental health and trauma
Yeah.
to substance use disorder, because that is how
Huge.
it starts. That is the groundwork for the foundation of a substance use disorder, right? Comes from mental health and trauma. So for someone to wake up and make that decision,
Yeah.
it's a lot more complex than someone just being like, today, this is what I'm going to do today.
Yeah.
Right? Instead of coffee, I'm going to smoke some heroin. Like, it's a lot more complex than that.
So much bigger than that.
Right?
Yeah.
So, and they have, United Nations have decided that that's what it is. It's a health disease.
And people need to understand that, I mean, this is scientific, backed up. However you look at it, people have got to understand that the science is there.
Yeah.
This is what it is.
And it is, like, it went on to say it is preventable and treatable.
Yeah,
It is.
right?
Right?
Yeah.
It is very much that. Is it easy? No.
It's not easy in a province or a country that doesn't have enough resources to take our people.
Well, that's
either.
another thing, right? Like, we don't have. We will talk about forced treatment.
I was just thinking that. I'm like, there's another.
We will talk about it. We will talk about forced treatment, but it's very easy for someone who's not struggling like that to be like, well, let's force them all to go to rehab.
Well, that's great, but why don't we take the people who currently have been asking for rehab and let them have it,
Yeah.
as opposed to forcing people who aren't ready yet,
Yeah.
which doesn't mean they won't be ready.
All of this to say, addiction is way more complicated than what people.
Yeah.
What society has deemed it as, right?
Absolutely.
So, and again, we will touch on all of these topics as we go. It's just introducing everyone, I think, to how complex these issues are and these topics are. There's multiple factors to an addiction. There's multiple factions to harm reduction. There's multiple facets to homelessness, right?
Oh, wow. We'll be going until about 2049. There is just so many things that can be discussed, and it is like pieces of a puzzle that get put together for the big picture.
Yeah, it really is.
Yeah.
So, we're excited.
Yeah.
We're really excited.
So
It's gonna be fun.
please listen to us. We're trying so hard. Oh.
No, honestly, it's. I'm just really excited to have another avenue to try to reach people.
Yeah.
And make it more accessible to people.
Absolutely. People need to know facts. Like, we got to build our community. We can't just go on opinions or hearsays or I seen this happen, but in all actuality, it was something else. But your misconception all of a sudden became a pillar of the community. Hold up.
And it's not that we're here to we're not here to pick fights. I don't know if you ever seen me and Tanya in a fight. I had to get taught the other day how a punch works.
Yeah, I wouldn't do well.
No, a client had to show me the other day how to properly throw a punch because I was doing it wrong. Not because I was punching someone, but because I was fake punching someone, and they were like, you're holding your fist wrong. It's just, we're bringing the facts. That's what we're doing.
Absolutely.
So I'm super excited.
Me too. Keep following along, guys. We've got much planned.
I'm going to say this now, even though Tana doesn't know that, and it's not set up yet. We do have an email if you have questions. Yes.
Oh, that's yes. And
it's in the link below, or on the side or above, because we don't know where the links are right now. We're not used to this yet. But send us emails about things you'd like to hear.
Questions you'd
like to you'd like us to answer.
Yeah.
We have so much planned. The topics we want to cover, the guests we want to have on, the just the information we want to spread, everything from fellow staff members to
our clients,
community members, non-community members, just kind of have very healthy, open conversations with people.
Yeah, we just want to shed some light, and we've got some great things lined up.
So send us an email with any questions or comments. Follow us on Instagram.
And the TikTok.
Follow us on TikTok. Follow us on Facebook. Follow us wherever you listen to your podcast.
Still all new.
Still all very new, but we're super excited.
Well, I think we should bid our folks farewell and see them on the next podcast.
That was love. That was so good. That was so good.
I sound like a wheezing dog.
You
oh
did.
my God.
Thanks everyone for listening to the first